Hi, I'm Maya Scott, and I'm presenting a case on transient hip synovitis. Transient hip synovitis is a condition that is characterized by the inflammation in the synovial lining of the hip joint. It tends to cause pain in the groin and the lateral hip, antalgic gait, and restricted range of motion. The epidemiology of this condition is not well understood, but it is believed that it could be caused by viral infections or a disposition for allergic reactions. It is most prevalent in boys 6 to 10 years old and is commonly treated with oral NSAIDs, heat, and soft tissue mobilization. I'm presenting on a patient, a 21-year-old female lacrosse player who initially presented with bilateral medial tibial stress syndrome. She was removed from participation after her evaluation and she began rehab shortly after. Her rehab focused on correcting foot posture and core exercises because she was unable to do any exercises that caused her to bear weight. The patient was compliant with the rehab for 3 weeks. At the 3 week mark, she presented with a gradual onset of hip pain that did not allow her to walk, and the pain was about an 8 out of 10, and it also restricted her range of motion. As a result, the patient was put on crutches, and we referred her to see the physician. We got radiographs to rule out stress fracture. After the radiographs came back negative, the physician decided that there could be a possible case of transient hip synovitis. With transient hip synovitis, there's no diagnostic criteria, so it tends to be a diagnosis of exclusion. So once a physician feels like he has excluded all of the possible pathologies that could be causing the hip pain by using MRI or clinical diagnostic tools, he then prescribes NSAIDs, soft tissue mobilization, and non-weight bearing status if that's necessary, and then waits out the time to see if the hip pain will resolve, which would be something that would line up with the diagnosis of transient hip synovitis. So this patient was non-weight bearing for a week. She was on NSAIDs for a week, and the patient came in daily for soft tissue mobilization. After that week, the patient's pain resolved, and we were able to confirm that the patient did have transient hip synovitis. The clinical bottom line for this case is that the patient had a typical presentation of transient hip synovitis, but because she also had medial tibial stress syndrome, her case was clouded by her comorbid condition, and it diverged our diagnosis to think that it could be something that was caused by maybe by her compensating for her other injury, and therefore we were a bit slow with diagnosing the transient hip synovitis. This patient is also outside of the age bracket where this condition typically presents, and she is also a female, which also makes her presentation, which is something that would make her presentation atypical as a candidate for this condition. I think that it is important moving forward from this experience that if there is a patient who has an onset of hip pain that is gradual and there is no mechanism for this pain, there is nothing that is being confirmed by radiographs or MRI, I think it is beneficial to include transient hip synovitis in your differential and use the tools or the interventions that are proven to help resolve transient hip synovitis to see if this condition is present, because this condition will only last a short amount of time. And if the pain persists past 2 weeks, then you can move forward with another diagnosis that would be in your differential. But it is worth including it in the differential and ruling it out within a week or two, and then moving forward, either with the patient whose pain is resolved, like my patient, or a patient whose pain persists, and then you can move forward with your differential. Thank you.